Hi everybody, Dr. Vilen here. So one of the things we're going to talk about today is your VO2 max and how do you know if your VO2 max is on target for meeting your goal. For those of you who've been following along with my Instagram, I've been doing a review of my 45-year project, of which I'm 15 years in. One of the big things with that is having a VO2 max at 75, which is going to let me backcountry hunt until then. So I've been doing some testing, and one of the things that I found is based on my testing on the treadmill, I'm estimating that it takes about a VO2 of 25 in order to walk on the treadmill at 2 miles an hour, 7.5% grade with my 45-pound pack. So it means if I do some math and go backwards, that when I'm 75, I need to have a VO2 max of about 36. And that will give me a good baseline and can be confident that I can go ahead and I can do my backcountry hunting with a reasonable load and sort of hike as much as I need to. And so where am I at now? That's one of the big things. And so right now, when I did my most recent test in January, I wasn't there. So my January VO2 max was below where I needed to be. I'm at 46, almost 47. And when I did the math going back, right, at age 45, which is coming up in about 2 weeks, I need to have a VO2 max of 49.5, call it 50. All right, and we can also look out and then at age 55, I got to have a VO2 max of 44.5, and at 65, it has to be 40 in order for me to be where I need to be at 75. So that means I have some work to do, and so over the past several months, what I've done is I've added one very specific VO2 max workout in per week, and I've noticed a difference when I've been on my hikes. Again, if you've been following along with Instagram, I do a hike once a week up a pretty steep incline for time and add weight if I meet my time objective. And so I'm well ahead of where I typically am in a year with being able to do that with weight. So I think that VO2 max work is really paying off. So in 14 days or so, we're going to retest and see if I'm now sort of at the benchmark that I need to be, and then plan on retesting every 6 months. There is some natural decline, about 10% per decade with VO2 max, just due to aging. But now I have the data that I need to make informed decisions and make sure I'm staying on track over the next 30 years. So when I do turn 75, I can be confident I can go out there, put a pack on, get it after it in the mountains, and be able to do all the other things in life that maintain my function. So if you want to follow along on Instagram with this journey, we're going to be talking about some of the other things that I've learned over the past 15 years as far as training and how I view my health just as a physician. There's a lot I've changed over the past 15 years in being a physician and how I view health and how I approach health for me and my patients. So I hope you follow along on Instagram. You can follow along here on YouTube. Be sure to ask us any questions. We certainly offer a lot of services at Intuition Health, really tailored towards the backcountry enthusiast, whether it's hunting, skiing, hiking, climbing, and making sure that you can do that really until the day you keel over. That's our goal because we know it's your goal. Take care, and we'll see you in the mountains.